Welcome to NCSS Here for You. Since 1958, Northwestern Counseling and Support Services has been providing access to high-quality services which promote healthy living and emotional well-being to the residents of Franklin and Grand Isle counties. Over the years, as the needs of the community have changed, so too have the programs and services that we make available to assist children, adolescents, adults, families, and seniors. We take our role in the community seriously and strive to provide the highest quality services. According to Eric Erickson, a noted developmental psychologist, every person must pass through a series of 8 interrelated stages over the entire life cycle. NCSS provides a continuum of services to meet the needs of individuals who at any point seek assistance. NCSS's purpose is creating a stronger community, one person at a time. Now, let's get to today's show.
I'm Joe Halko, Director of Community Relations for Northwestern Counseling and Support Services, and welcome to another episode of NCSS Here for You. Each month on this program, we discuss a human services topic, and we do that with staff from one of our 3 service divisions. Our 3 service divisions are Behavioral Health Services, Children, Youth, and Family Services, and Developmental Services. And on occasion, we have guests from organizations that NCSS collaborates with throughout the year. This month's episode is titled Franklin Grand Isle Community Partnership. In 2009, the state of Vermont eliminated the funding to support a coordinator for the community partnerships throughout the state. Locally, a decision was made to continue the collaborative practice of bringing the partners together that serve the residents of our community. You may ask, what's the benefit of continuing this process? To discuss this subject in greater detail, I'm pleased to introduce this month's guests. They are Kristin Pryor, Agency of Human Services Field Director for Franklin and Grand Isle counties, and Melinda Lussier from the Turning Point of Franklin County and Vermont Recovery Network. I'd like to welcome both of you to the program this month.
Thank you, Joe.
So let's start with, what is the Franklin Grand Isle Community Partnership and why does it exist?
So the Community Partnership is a group of folks from community places and state agencies that come together, both nonprofits, for-profits, community education, Community High School of Vermont, all kinds of organizations that come together to connect, to network, to understand each other's missions and visions and what they do so that they know what resources are available to them in the community. We also meet with the legislators twice a year to get their input and to provide input to them about what we'd like to see happen.
And then I would say, for why does it exist, it's an opportunity for partnerships to come together, for community members to come together and not only avoid reinventing the wheel, but understanding what our fellows do, knowing how to refer people, where to refer them to, what we're referring them to, and more than anything, to have an open communication and real-time updates on what's going on within those organizations.
It also offers an opportunity for the state, the Agency of Human Services specifically, to interact with our local partners so that we better understand what we're all doing so that we don't duplicate services, or if there's a gap in services, we can figure it out for that individual or family, and then on a systems level as well.
I think one of the biggest things that both of you have stated is the fact that, number one, duplication of services. Certainly, I think every organization wants to not do that because then you're not really spending your dollars that wisely. And secondly, as you said, Kristin, is the gaps in services. And if you were to roll back the calendar, say 10 years or 15 years ago, and then look at it today and look at how immensely different the services that are being provided are, it's because of that there were gaps over time because of the way the society changes. And you're both right. I think the fact that having all of these organizations collectively at the table to be able to talk amongst one another, get a better understanding of what each other does, you try to maximize your resources.
It's also another opportunity for the community to brainstorm together about big issues. For example, the opiate epidemic that we're experiencing right now. It's a great forum for people to learn and understand and find out where we came from, how we got here, and what our plan is to move forward. So that's one of the biggest things that we do, is we come together as a group to figure out what we're going to do. And so that is an amazing opportunity for people to work together collectively and make a bigger impact.
I'd have to say too, one of the beautiful things about the partnership is that, especially coming from, a Turning Point, Vermont Recovery Network, is that we're solution focused, we're solution oriented, and there's not a lot of forums that you can go to acknowledge what the problem is. We want to know, but we don't want to sit and discuss the details of it. We want to get into what is the solution, and that forum is a beautiful place to do it.
Right, we look at strengths instead of focusing on weaknesses, and we try and figure out how to make our community better, safer, and stronger.
Now, we talk about the group. When does the group meet, and who's included in these discussions? What types of organizations?
So the group meets on the first Wednesday of the month from 8:30 to 10:30. From 8:30 to 9 is an opportunity to network with the partners, and then from 9 to 10:30 is when the actual meeting takes place. There's often presenters. One thing I love about the group is opening up with introductions of who is at the table, where they're coming from, and then something new and good. And that is not necessarily always to do with the organization. That might be on a personal level. So not only are we building relationships with these organizations, but we're building relationships amongst each other and being able to understand better who each person is, why they're motivated to work for that organization, and generally they've got a vested interest personally, which makes them more passionate, which is why that group is such a strong, awesome group. So yeah, it's the first Wednesday of the month, minus the summer months, which we take a little hiatus and we miss.
The other thing that I really like about this meeting is that it allows people the opportunity to share what's happening in their organization. So if you have a fundraiser, or somebody is having an event, or you're doing advocacy for an event, we sometimes pass around things that people are encouraged to sign for support. But it also gives everybody an awareness that, like, I'm doing a behavioral interventions conference, so to speak, and then you aren't going to do the same thing, because we're understanding and knowing what everybody's doing, so that we aren't, again, not duplicating services, but events as well in the community. And we talk about what the community needs are, so that everybody can come together and work, again, collectively. Do more with less.
Now, as you've said, it seems that one of the important aspects of this monthly meeting is the networking portion, which is at the beginning. What makes that part of the meeting so successful for those that attend? What is the crux of why people are, and the reason I say that is because many times when you go to meetings, the meeting is set for a given period of time, 3 to 4, whatever. People show up for the meeting, they have the meeting, they go off on their own. Yet that meeting may have had a lot of individuals sitting at the table who have a common interest, but they can't quite get to discussing it because it wasn't on the agenda. So when you look at this networking portion that seems to become more popular over the past couple of years since it was instituted, what is it that you think brings people to the table earlier than when the meeting begins, and walk away with a feeling that the time that they spent was really worth those extra 30 minutes or so?
I think part of it you just touched on is the opportunity to talk with people outside of the agenda that's already put into place, because there's often a lot of questions that might be, I can say for myself personally, I love being able to go and connect with people from the Howard Center, from Northwestern Medical Center, from other services that we may have some of the same people coming to our services. So how can we discuss maybe new programs that were announced at the previous meeting? How do we discuss how an event went and get more details on that? It gives us an opportunity to get down to some more information and details on those specific people's services, and it also gives us a personal connection. And I think that the most important thing for any organizations is to have relationship with someone that we are doing the work with, because there can be roadblocks and difficult, aspects to our jobs, and yet when we have somebody that we can that edifies us and that we can work together to again stay solution oriented and to kind of build each other up, that's the opportunity we're given in the beginning when we're talking to people, because it's not just about the organization's coming up with a structure, coming up with a plan, but it's about the individuals as human beings that might even have situations in their own personal life, and somebody at the table has a solution for that, and they wouldn't have otherwise known. So it gives us a chance to ask some questions that we wouldn't be comfortable asking in front of the group of the community partners. So I think it serves a number of purposes on getting a little bit deeper.
It's the informal meeting before the meeting, or the meeting after the meeting sometimes, that we've formalized in a way. And often I get there and I think, oh, there's Joe, I need to talk to him about that, something that I may have forgotten about. Or you'll spark something that I'd been thinking about and that you were thinking about, and then together we get more people and figure out how to do something with it.
And let's face it, it's a great chance to eat the cookies and drink the coffee.
Food always rules out. Right?
Absolutely.
We talk about the group, you know, to give people a sense, roughly, on average, how many people attend these meetings each month?
It varies, but certainly we have recently had between 30 and 35 people at most events, and some of them a little more. But more importantly, you've developed this great mailing list with over 100 people on it. And so every week, any updates that we have or job announcements or anything that we want to get out to the community, this bigger, broader audience that involves nonprofits, states, for-profits, all these organizations, you send out a weekly email with our flyers, with everything. And so people are reminded, oh, I need to tell my staff about this, or oh, I need to go there this weekend. And you can refer lots of people because you have this really broad array of information that comes out every single Friday, even all summer. When we're on hiatus, the information still comes out. And people use that to get word out for things.
Well, one of the things that is interesting is we talk about how many people are in the room, but you're right, Kristin, there is a much broader group. It doesn't mean that those individuals never come to meetings, it's just that they can't be there all the time because of their schedules. But the nice thing about the partnership is the fact that it is in excess of 100 people that week in, week out, or month in, month out are being kept abreast of things that are going on in the two-county area.
And I share it with almost everybody on my mailing list in the building. So, I mean, the ripple effect of people then sharing that email with more people, it reaches a lot of people.
Exactly. That was what I was going to mention too. Last month, I believe it was 118 people that are getting the email, but in turn, those people are sending it off to their staff, to other partners who may not have come to the table yet. So it's spread pretty wide. We got long arms, even if those people aren't in the room itself. Yeah.
Now, Kristin, you had mentioned earlier about the legislators and the fact that they're invited both pre and post session to the partnership. And you also mentioned that, you know, of course, the idea of doing that is we want them to be as informed as possible, and we also like to know from them after the session what types of hurdles that they had to overcome, and you know, truly what's going on in Montpelier, what we can or can't expect as organizations. There was a point in time they were not invited. I mean, they just weren't invited. I mean, they were always welcome, but there was never a dedicated effort to have certain months that were stipulated as legislative months. What would you say from the point that the organization started doing that? How has this advanced itself, and to what degree do you think it has really helped to inform our local legislators on issues that maybe they wouldn't have as much of a sense of if they weren't in the room?
Well, it's interesting because in Vermont, we have this really amazing ability to interact with our legislators really closely at town meeting and on a daily basis because they're a voluntary legislature. And it's so unique compared to other states. And so many of us already know these people in our community, but we may not have really understood their role in the legislature. And so having them come to this meeting and really just sit and talk with us like we're doing today, we get to really understand the hard work that they're doing, and they get to hear from us our concerns about things in a way that I'm not sure that they could capture just in somebody sending an email or writing a letter to them. Being one-on-one and being able to really have those hard, difficult conversations about money, about programs, about opiate addiction is just amazing. And you know, we're all kind of on a first name basis with them, which is really, really a great way to interact.
It truly is, and you're right. When you look at states in general, I mean, we're very fortunate in Vermont to have the access to our legislators the way that we do. And I think that from a standpoint of the partnership, you know, we're really trying as a group to do the best that we possibly can to keep them informed, not only before the session begins, but throughout the session. But certainly, you're right. I mean, we understand the fact that the state is only so large, there's only so many dollars, and there's a lot of difficult decisions that have to be made each year.
A lot of competing agendas, and it's a really nice way to hear each other in a very safe, conducive place to have these conversations so that they can take that back, because I'm not sure that they would hear that stuff if we didn't have access to them the way that we do.
In addition to that too, not only, as Kristin said, do we have those conversations with them on that day, but they contact us personally after that. I've had continued communications, questions come up, and it is definitely on a first name basis, and it's also trying to do the best that we can to work with them so they understand what's going on in the community, because they do care, and it's a matter of how do we get questions answered by the people that are on the front lines.
Yeah.
So it's a great, the legislative meetings that we have where they show up, that's just the beginning. So that's a beautiful thing, is they stay connected.
Now, what types of collaborations and positive outcomes have resulted from the partnership? I know we talked a little bit about the networking and how that has changed that whole meeting, but there have been certain collaborative efforts, and you know, you think in areas like substance abuse, you think of domestic violence, you know, a lot of the areas that in this part of the state, the numbers might even be higher than, say, in some other parts. So what is your feeling about the types of outcomes we've been able to show, at least, say, over the last 5 years in a lot of these areas by coming together as a group? And I know it's difficult to sometimes quantify it. But,
well, that's the thing. There's anecdotal evidence, and then there's results-based accountability evidence.
Right.
And I know that Amy Brewer would talk to us about the tobacco cessation and how much we've reduced teenage smoking. In partnership with her, all of us working with NMC and her program to do that, because it's always on our minds, because Amy makes sure that we remember that. And that's critically important. The Community College of Vermont, they're at our table all the time. And we learn about programs they're doing, we refer people, and if they weren't there talking about that, that wouldn't be happening. I think about all the partnerships that we have, the opiate addiction stuff, you know, that we talk about there. And for me, the biggest thing that I've seen is a reduction in stigma around getting mental health services and substance abuse services, because we talk about it openly and honestly and really brutally about what it means to families in our communities. And by reducing that stigma, people are more willing to get the treatment and the help that they need sooner and stay in recovery longer.
Yeah, certainly one of the things that people do need to get over is the stigmatization of these topics. Because you're right, Kristin, when you think about it, and I know I bring this up a lot, is if somebody has a broken leg or they're dealing with diabetes or even a serious cancer, they will talk about that, and they will talk about perhaps what progress has been made or what struggles they're undergoing.
Or what they need.
Or what they need. But boy, the minute you talk about a mental health disorder or somebody that is dealing with opiates or whatever, everybody runs for cover and they don't want to face it head on. You're right. One of the things that I think this group does very well is openly talks about everything, and the fact that there is help available, but it's a matter of somebody coming to grips with what they need to do and then hopefully moving them in that direction. And that's been very encouraging to see the group be able to start breaking down some of those barriers, because I mean, it's a lifelong challenge for everyone who's involved with it, but if you don't start somewhere, it's never going to go anywhere. So.
Integrating family services is another great example of the partnership between NCSS and the state around payment reform and bundled rates for families and children. And we've made really significant strides. We're the second location to take this on, and it's really changed the way that we look at families and children and the way that we treat them. and the way that we're able to treat them holistically as a family instead of just one person in that family unit.
And that's so critical because, you know, it's one of those situations where, you know, if one family within the family unit, one individual within the family unit is really struggling, and you take that individual out and you really work with them and get them on the right track, but there's still an issue over here, and you put the individual back into the family, things are not going to go the way that you anticipate when the individual is taken out. So you're right. It's really dealing with all facets to try to ensure that there's success for those individuals.
That's such a good point too, because when you look at the big picture of somebody who's struggling with substance abuse, the person who's struggling themselves, obviously that's where a lot of the focus is.
Yeah.
However, what's forgotten is what it's doing to the family. So where do the family members go to get that help? Because while an individual is at treatment and getting help, they might be getting stronger, and yet, you know, we often encourage them that when you go home, you can't assume that everybody else is working a program.
Right.
But how nice would it be if everybody else is able to? Lots of times we get people that come and ask us what to do, where to go, because they don't know, and yet as this partnership has continued to go, communications go out, people realize that there's a lot of family support groups. And sadly enough, I don't see a lot of attendance, even though there's a big need, but it has grown as a result of getting that conversation out on the table, as a result of not stifling what's going on because of stigma, because of discomfort. We just put it right out there and talk about it, because it's not focusing on the behaviors, because bad behaviors are a result of addiction, yes. But the individual is still a good person, a sick person that needs help. So how do we get a perspective that this person deserves help, is a good person, needs a chance, and try to separate the person from the offense? And as the person gets healthier, those offenses go away. And in turn, when a person gets into recovery, they rise above, and they're driven because of their passion for knowing that their life was spared. They in turn help others. The family does the same thing. Family members who have seen their child's, their parents, their spouses go from, you know, the bottoms, the brinks of almost death, to coming above and rising above and having hope, those family members can share with other family members and let them know that even though what you're hearing and seeing, it is scary, but it's not abnormal, it's not unique, and there is a solution. And here's where the solution is. And at the table of community partners is where those solutions are brought out on a regular basis.
And the individuals that we have come speak every month at our program, which we have a list of people waiting to speak, are usually sharing really exciting outcomes and ways of doing things in a different way, and it's inspiring, and people want to do better and do more things because they hear how well other people are doing. So it's very contagious, that inspiration and that wanting to do the work, and so that's really helpful as well.
You know, and talking about all those that are at the table and all these various organizations and all the great work that's being done, it's still been difficult to get the business community at the table. And I don't mean to say that everybody from a given organization needs to be there. I mean just an individual to represent them. Why do you think that is, that it's so hard to get a representative from for-profit business organizations at the table? Because there's so much work that's going on to help their staff that they're not aware of, and resources that are available that they might not be aware of. But I know we try to get them to understand this would really be valuable, but at least to date, we've had very little success. Is there a reason you feel is the major roadblock to that?
I believe a big portion of the reason is the lack of comprehension in the value of having somebody at that table, because there's that time is money outlook,
Yep.
and yet we don't have any kind of statistics to give them and say, well, this amount of your time will benefit you with X amount of dollars in savings. That's something that's really hard to quantify. However, if they would be able to realize that it would make the employees more productive, healthier, and then bring it into their family life, that in turn, that alone would make more production. That alone would make more money, make more benefit. And yet, to find a way to communicate it to them like that can be difficult until you get them to the table and they can see it firsthand. I think it's totally doable, but it's just a matter of them understanding the value of it, because it's difficult without statistics and reports to hand over the value of being part of this partnership.
It's an investment, you know, in the community, in yourself, in your employee. And until people understand that, you know, I'm giving up an hour and a half, maybe 2 hours a month, but in return, I get all of these benefits. I get this mailing list, I get to advertise or send out information to a whole group of people that's really a very big ripple effect. And until they understand that it's a win-win, it's a benefit for both, I think we're still going to struggle with that. And, you know, people really are very lean in making money. You know, it's changed. And so they have to look at the bottom line. But I think we're working on it, and we're going to get them there.
Exactly.
Well, you know, when we talk about statistics and that, I mean, not when you look at our group overall and all the various services that are offered, if we just take one area, and that is, say, depression, is numbers indicate that annually depression costs companies nationwide $79 billion in lost productivity. And that's because you could have someone who gets to a point where they no longer get out of bed in the morning, and therefore that leads to them not showing up at the job, and therefore that leads to how, you know, now the employer has to figure out, depending on what kind of job that person has, how are they going to fill that void that day. Or the person could be on the job, but they're suffering from mild to severe depression, and they are not able to function at a what you'd call 100% level. So I guess what I'm saying is, I know in the world that I come from, is that's just one example of a condition that people don't want to get help for, because everybody will say, well, you know, everybody feels a little depressed from time to time. Well, true, but it's when you get beyond the, you're just down for an hour or for a day or what have you, that things can begin to kind of spiral out of control. But to your point, Melinda, and you're right, is, boy, if we could come up with some kind of a chart or something where we can kind of quantify what the effects of, you know, whether it's opiates, whether it's mental health, you know, whatever the scenario may be, and almost have it like a funnel and show how much is really, it's really costing employers. And it's kind of a, you know, a blind number until you really look at it. You're not really thinking as an employer, well, it's this, that, and the other thing that's causing all this. You know, it's just so-and-so's not showing up.
Right.
So I guess what I'm saying is somehow we've got to figure out a way to, because I really do believe that there's a lot of organizations throughout our two-county area that would really find it valuable to be at the table.
Well, and the first aid, mental health first aid training that we talk about a lot at the Community Partnership, and NCSS has offered quite a few times to in-staff and to the public, is another great example of just another way that people can benefit from coming to this meeting, because it really helps individual, normal, everyday people be able to just identify somebody who's really struggling. I don't have to be a clinician, but I just need to be able to recognize there's a problem and refer them for appropriate assessment and maybe treatment.
Yeah, that's true.
I think a point too that was clearly made in the beginning, I remember there was a presenter that showed a National Geographic episode, and two of the key points that stood out for me, and to this day I tend to repeat, is in a society that is always saying, what's wrong with the world, what is wrong with the world? Well, let's focus on what's right with the world, so we have the energy to fix what's wrong with the world. And then also in doing so, we get that personal subtle shift of trying to be the best for the world instead the best in the world. So if you can bring that kind of mindset into somebody that is an employee of a corporation who has this outlook of, I want to be the best for the world, not just the best in the world, then in their job, if they have a little free time because they're more productive and something needs to be done, they might do that as opposed to, well, it's not my job.
Sure.
So it's just having that healthier mindset as a whole. And I think for me personally, and even for the organizations that I'm part of, having that outlook on trying to be the best for the world makes us more productive, and it has a ripple effect. So you have one happy, healthy employee that's productive and doing above and beyond because they feel good about doing it, not because it's the title to do, and that flows. So I think that if different corporations could see that as another benefit, in addition to the person themselves just being happier and healthier, there's so many benefits. And it's just a matter of how can we get them to really see the value of this, because it's not just about dollar amounts. It's about just people being happy all together. And who doesn't want to be happy? You know, who doesn't want to be happy?
So true. And what a great way to end the show this month on a positive note. And I want to thank my guests, Kristin Pryor and Melinda Lussier, for being on the show today and sharing their insights on the Franklin Grand Isle Community Partnership. I also want to thank you, the viewer, for spending time with us again this month. You can learn more about NCSS and all of our programs and services by logging on to ncssinc.org. I'm Joe Halko, and I'll be back next month with another episode of NCSS Here for You.
This has been another episode of NCSS Here for You. We hope that you found today's discussion informative and educational. Since 1958, Northwestern Counseling and Support Services has been providing access to high-quality services which promote healthy living and emotional well-being to the residents of Franklin and Grand Isle counties. Over the years, as the needs of the community have changed, so too have the programs and services that we make available to assist children, adolescents, adults, families, and seniors. Thanks once again for tuning in this month. NCSS's purpose remains creating a stronger community, one person at a time.